In this video today, we're going to talk about injecting your fingers with PRP and why it's way better than anything else. If we haven't met, I'm Dr. Orlando Landrum. I'm an MD who helps patients understand what are their options for dealing with either physical pain or mental pain and how to be able to punch pain in the face and get back to leading the life that you deserve. Today, we're talking about finger pain and how it can be incredibly impactful, so much so that it may reflect other disease that you need to know about and need to be able to intervene upon. Traditionally, when we think about an injection to the finger, we think about something like this, which is not something that most people want. They're like, oh my gosh, this injection to my hand, it's sensitive, it's tender, and I just really don't want to deal with that. So before we even talk about injections, let's get an aspect of understanding why. So when we look at the hand, there can be a number of things that can give problems. It can be everything from a trigger finger, as just mentioned, to something like osteoporosis, scleroderma, Raynaud's, palm injury, bone fracture, carpal tunnel, ganglion cyst. And so some of those things like osteoporosis and scleroderma, we may have the hand be the first presenting complaint, which basically means this is the first sign that we see. And so you can use that by talking to your doctor or a healthcare provider to be able to say, you know what? I think I might need to kind of get some tests run, which might be hugely impactful because some of those things can have impact just outside the hand. They can have issues with your heart or your lungs. And if you can be able to get an understanding sooner, you may be able to improve those things from being a problem and an issue. As we look at the hand as a whole, we know that there's a level of simplicity, but complexity. So what we can see is that there's multiple different bones that are present in the hand. What most people think is that, oh yeah, my fingers have bones and then I have the radius and ulna, but they don't think too much about the wrist. The wrist has a ton of bones that are present there, and they're laced in together with these ligaments that are in place. The muscles that overlie that are incredibly complex. They look like this net of different tendons and such that are intermingled that allow for us to be able to move fingers down, move fingers up, be able to use them independently in order to be able to do the task that we want to be able to do. In addition, we have a blood supply that's present that also is incredibly important. So we see this intermingling of nerves and vessels that are present in and around the bones with different arches. And one of the reasons why this is important is you certainly don't want to inject, if you're going to do an injection, into areas that are critical that can't sustain an injection. So how can we avoid those type of things? How we can avoid that is by using a live ultrasound to be able to identify where the structures are, where a needle happens to be going, and how to be able to make this better. So what we'll see is pictures like the following. We can be able to identify tendons and muscles and things of that nature, as well as blood vessels that we may not want to get into. So when we talk about injections, for those of you who are a little bit squeamish, you might want to turn your head. We can see the following. You can see injections into the area of the carpal tunnel in the wrist, injections at the base of the thumb, and injections into the trigger point region. So all those type of things done traditionally are done with a mixture of local anesthetic and steroid. Traditionally, something like xylocaine, but it could be bupivacaine. It can be a mixture of depomedrol or celestone or triamcinolone as their steroids that are in place. And why you would normally do this is because you want to have an anti-inflammatory effect and some degree of pain relief from the steroid. So the challenge with that is that it doesn't always work. And so if we talk about it not always working, this gives us some insight. So what we can be able to see is that when we take a look at steroids, about 1/3 of the time, it comes back and it doesn't work at all. And so most people would say, yeah, okay, so no big deal. Well, it actually is kind of a big deal. And so the reason why is because we see that after we try this trigger finger injection, traditionally, the next step is to go to surgery. And most people are like, well, I don't know how bad surgery might be. Let me show you. So this is a traditional surgery where you're going in to be able to kind of take a look at the areas of the tendon and you're isolating for that region to try to be able to improve this. Not many people really want that. I can't imagine why. Well, as we go in, we talk about, are there other options that might be in place? Yes. So one of the things that we can see is that PRP, or platelet-rich plasma, may be useful. And this paper talks about it. It actually uses it in combination with another technique, but we're going to talk about some other papers. Now, make no mistake, I am not saying, as a doctor, there's no indication for hand surgery. I'm not saying it. But do I think that there are options that you can be able to avail yourself of that might not require you to use hand surgery? Yeah. And so let's talk a little bit further about that. So one of those papers is the following: platelet-rich plasma in the treatment of recurrent flexor tenosynovitis of the wrist that's complicated with carpal tunnel syndrome. So when you take a look at the picture, and yes, I know it's a mouthful, but bear with me. What you can be able to see is that there's this swelling that's present in this person's wrist. And then in addition to that, you can see that they aren't able to move their thumb with full flexion like you would hope that they could over here on the left side versus compared to what they have on the right side. So when you actually did this PRP injection, what you saw was the following in a table form. Is that you saw that initially this VAS, which is indicative of pain, 0 being minimal, 10 being intense, was initially a 7, which is pretty intense. In addition, they also had a DASH score of 47.75. I'm going to tell you what the DASH score is, but in essence, it's a functionality, how well you're doing. And most people say, oh, 0 to 100, not that bad. I'll show you why it's bad in just a second. But anyway, post that PRP injection, what you can be able to see is that after about 6 weeks, you have an improvement of the pain score from a 7 to a 5. Most people say it's not that big of a deal. And then you see this improvement in the DASH score from 47 to 29.5. We'll talk about that in a minute. But when we think about this 5, from a 7 to a 5, in 6 weeks, we're like, well, that doesn't sound great. When I normally get a steroid injection, I'd get better in maybe a day or two. And it might last me maybe 3 or 4 months. It would, but there's a few different things. One, when you talk about doing steroid at the site, is not only might it come back, it also might make that tendon worse. And the reason why is because you're introducing a substance that is trying to be able to stop inflammation. But inflammation is sometimes linked to the aspect of healing. And so PRP helps foster that healing. So when we go back to that table and we take a look, in 12 weeks, what you see is the pain is all the way down to a 2 and the DASH score is all the way down to a 9. So what does that mean in being able to understand that in an interpretable way? Well, it's the following. So when you look at a DASH score, when we have this 47, it's greater than 35. So it's a poor degree of function, meaning you can barely be able to use your hand. When you get down to that area of the 27 or 29, it's adequate, it's satisfactory. But when you're able to get down to that lower single digit score, you can see it's excellent. You get your ability to be able to do the things that you want to be able to do regularly. And why that's a difference than normal is because sometimes, whether you're talking about doing an injection or taking just an anti-inflammatory like an ibuprofen, you're getting the pain better, but you're not improving your function. And this is why you should consider doing PRP as a potential option. Is it covered by insurance? Most of the time not. And is it potentially pricey? Possibly. But at the end of the day, what we're talking about is investing in yourself, investing in an ability to be able to say, not only am I going to make my pain better, but I'm going to improve my function. And so what can that be able to prevent? What it can be able to prevent potentially is the following, is those hand and wrist things that initially seem pretty innocuous or not so bad can possibly lead you to carpal tunnel. It can lead you to that recurrence of trigger finger. It can cause you to have development of cysts, or you can have physical changes to the hand, which result in dysfunction. At the end of the day, what I want you to know is that you have options in order to be able to improve your overall health and that you can be able to do things better than what you may be doing right now, and you don't have to be stoic. If you're interested in connecting to our clinic, you can kind of see the banner below and ticker that allows for you to be able to kind of find us online so you can be able to reach out and connect. And if you're interested in learning about more videos like this, please hit the subscribe button. Would love for you to be able to kind of see some other ways that we help you understand how to be able to punch pain in the face, whether it's physical or whether it's mental, and how to get back to leading the life you deserve. Thank you so much and have a great day.